Thanks for coming out tonight. And like I said, we should leave some time at the end, so think of those questions that you might have and jot them down, and we'll try to get kind of everything answered for you. So on that note, either congratulations if you have a new one at home, or congratulations if you are expecting one. These are definitely some of the most exciting times in your life, and you'll get to see kind of lots of pictures of my little ones scattered throughout the show. So you are going to be seeing your baby's pediatrician very often in the first several years of life. So I definitely recommend starting early, interviewing some pediatricians, kind of try to find one that fits with kind of maybe your goals on raising a child, close to home. Ask friends and family. Through Children's Physicians, we have free get to know you visits too, where you can kind of go in and see the office and meet with the doctor. So there's lots of different options, but really you're going to be seeing your pediatrician very often. The first typically true scheduled visit is at their 2-week checkup. However, oftentimes we will see these babies for a couple times before that visit to make sure that they're feeding okay, that they're not losing too much weight, not getting too yellow or jaundice, kind of all that kind of important stuff that happens usually more the first few days after you guys go home from the hospital. But then really the biggest scheduled visits are 2 weeks, then 2 months, 4 months, 6 months, 9 months, a year, 15 months, 18 months, 2 years, on occasion even 2.5 years, and then really yearly thereafter. The things we look for at well-child visits is we monitor their growth, make sure their weight is, they're gaining weight appropriately, they're getting taller like they're supposed to be, their head size is doing okay, making sure that their development is right on track for milestones for their individual age. It's also time for immunizations, which usually start at the 2-month checkup, and it's time to bring up common concerns, any questions that you might have, just kind of a good general visit. And this is kind of a brief snapshot in general of immunizations that our kids get starting early on, and it may seem like a lot, but really it's not as bad as you may think, and it's kind of a standard immunization schedule that we follow pretty closely, that we go over in a lot of great detail at each of those visits. But really what immunizations are is they are germs, so to speak, that are introduced into the body to produce antibodies. And heaven forbid if your child or yourself is exposed to any of these germs, your body then has antibodies in your blood kind of ready to go attack these germs. And oftentimes that may mean it prevents the disease completely from happening, in which a lot of our vaccines do, or it causes a really mild case of the disease to maybe influence its severity so that you don't end up in the hospital or getting really sick from the illness itself. And when you think of the scope of the amount of germs, so to speak, that are in each of our vaccines, the number is very, very small compared to what your child and even yourself is exposed to on a daily basis. Just being out in the environment, in the community, you are exposed to thousands of germs on a daily basis, probably even more if you're around other kids or you're in daycare. So really the amount of germs in the vaccines is very, very small when compared to what you're normally exposed to on a daily basis. And the schedule has been studied in great detail over many, many, many years to really provide the maximum protection against certain diseases as soon as possible. That's safe to do and that's effective to do. And that's why we do vaccines at a young age, because the young have a better immune response to these vaccines than adults do. And typically by doing all of our boosters when they're young, sometimes protects for many, many, many years against those illnesses where adults sometimes require boosters a little bit more often. So I'm going to run through some developmental milestones. These are things that typically are asked about at each of the visits. For the 2-month check, typically our babies by then are lifting their head better. They still may be a little wobbly at times, but they can lift it pretty good. They follow objects to the midline, which means if you have an object to the side of them, they will follow it at least to the center of the body. Sometimes they'll even follow it like a full 180 degrees. They'll start cooing by this age. Social smile, which means not so much the gassy smile, so to speak, when they're a couple weeks old, but they'll smile in response to your face or you smiling at them. And they know their familiar voices. They know mom and dad and grandparents if grandparents are around very often. For 4 months, they hold their head very steady, no more of that wobbling at all. They often, when they're on their tummy, will push kind of themselves up on their arms much better than they did when they were 2 months old. Typically the 2 months old still kind of have their head on the ground, or will kind of move it side by side. But by 4 months, they should really be holding their head up pretty good when they're on their tummy. They may attempt to roll over. Some are a little more stubborn than others. Usually if they're going to, it's when they're on their tummy over to their back. They can grab a rattle. They may not know necessarily what to do with it or how to let go of it, but they will grasp it. They start laughing at this age. They will turn to sounds and look for where it came from, and they can blow bubbles. Typically by 6 months old, your baby often will roll from front to back and from back to front. They can sit with support, and sometimes you'll see them kind of sitting with their arms out in front of themselves to steady themselves, but they can do so with just minimal support. If they drop a toy, they'll try to look for it, and they usually like to start playing the game of pick that up by this age. They'll turn to voices even more so, especially other people's voices instead of just kind of mom and dad. You call their name often enough and they really begin to recognize their own name by this age, and sometimes they'll even try to grab like a spoon and help feed themselves. They're not going to be very successful, but they will kind of try, or they'll try kind of to pick things up. But really by 9 months is when they can pick things up better. Kind of at 6 months they do kind of a raking movement to get like a toy or something on the ground that they want, where they kind of rake their hands to bring the object to them. By 9 months they get that pincer grasp, which is usually between their thumb and their first finger, to kind of pick up little objects. Around 9 months they'll pull themselves to stand up to the couch or a chair. They may be crawling, although not all kids will crawl, or they kind of will scoot around on the floor. Stranger anxiety definitely is usually pretty well developed by this age. So usually they kind of get some separation anxiety too. That can sometimes even start by 6 months. A lot of 9 months old will say mama and dada. They may not necessarily know what that means, and they might just say it to say it without, really wanting one of their parents, but they usually can put kind of these sounds enough together to say those. They'll wave bye-bye. They will look at books. By 12 months, often they will stand alone, maybe just for a couple seconds, but they can do it. They usually will cruise, meaning they'll walk holding on to the couch. They'll walk the length of the couch holding on, or a table. They can play ball and kind of just throw it a short distance towards you. If you give them a cup and a little object, they'll oftentimes put the object into the cup. They like to bang two objects together. They'll point more, especially to things that they want. They'll imitate activities. So if you're blowing kisses, they might try to blow the kiss. If you're putting a toy in a bin or something, they will kind of try to imitate those activities. They can turn book pages better, and usually by 12 months they can feed themselves finger foods, and they'll want to do so. Most kids by 15 months old will walk by themselves. They oftentimes will stoop and recover, which means they can kind of squat to the ground and pick themselves back up without using their arms or sitting completely on the ground. They like to dance or kind of sway with music. They can understand simple commands like go get your shoes, go get your diaper, your cup, things like that. They'll try to scribble. Usually they'll have at least 1 to 3 words, and they can drink from a cup. They might spill a little, but they can still drink from a cup. By 18 months, they should go up steps. They can walk backwards. Most can run. They can put 2 blocks on top of each other to build a little tower. They can use a spoon and a cup without spilling most of the time. They know at least 1 body part, say at least 3 to 6 words, and they're capable of removing most pretty easy clothing. By 2 years old, they can kick a ball, throw a ball overhead. They can stack 4 to 6 cubes at a time. They can combine 2 words into kind of a little 2-word sentence. They have usually at least 50 words. They can put on simple clothing. They can do more pretend play and even imitate adults further. Vision. A lot of people think babies can't really see much of anything when they're born, and that's true to a certain extent. Their vision really is about 2200, but they can actually see pretty clearly for about 8 to 10 inches in front of their face. So with the newborns, you want to talk, you want to interact with them, but really you have to be close up. And they like high contrast colors and shapes, usually more the black and whites, things that kind of stand out against each other. They really like those sorts of things. So definitely talk to your babies, just do it more close up. As they get a little bit older, about 2 months, they can see then about 1 to 2 feet in front of them. And they start to pick up kind of more contrasts and colors. By 4 months, their vision is 20/40, and by 6 months, really, they have 20/20 vision and can see a lot of things across the room. So you kind of can't get away with as many things without them seeing you by that point. And their colors are all there too. They can see kind of a good variety of colors. Babies' eyes cross very frequently the first 6 months of their life, which is nothing to be worried about unless it's happening up to that, up to or kind of past that 6-month time frame. Then that's something to let your doctor know about, but it's usually something that we kind of watch for in clinic as well. Growth and nutrition. Like I had said earlier, at each well-child visit, we look at babies' weight, their length, their head growth, kind of plot them out on their curves, see where they're going, where they're trending. And typically, most babies will double their birth weight by 4 months. Oftentimes, I see babies kind of exceed these typical amounts, but in general, and generally triple their birth weight by about a year and quadruple their weight by 2 years. They have the most rapid growth definitely within that first 4 to 6 months. And then after that, as they're getting more active, kind of doing more things, their rate of growth is not so steep as it is the first 6 months. Their length also pretty rapidly increases during the first year to 2, and typically about age 2 is when we can have an idea of where their adult height is going to end up. And usually that sometimes if we take their height at age 2 and times it by 2, that'll kind of give us a general estimate of where they're going to end up. In terms of growth, really for the first 4 to 6 months, the only thing baby needs to drink is either breast milk or formula. Both of those have all the water that they need. It has enough calories, nutrients, kind of all the good stuff. So, sometimes we'll say kind of 4 to 6 months you can do a little bit of water, but really for the most part, really breast milk or formula is all that your baby needs to thrive. Some babies we do have on vitamin D supplements, and those are in babies who are breastfed either exclusively or if they drink about half breast milk a day. Those babies need some extra vitamin D because mom's breast milk has great stuff in it and just about everything that you need, but it does lack in vitamin D. And typically most adults kind of lack in some vitamin D as well, and that's part of the reason. So we just supplement with just a little bit of vitamin D drops every day. Solid foods. Usually we start those at about 4 to 6 months of age. The best things to start with are your single grain cereals, so either rice or oatmeal, fruits, veggies. And really, there's no rhyme or reason. Pick any of those you want to start with and go with it. The biggest thing to do is once you kind of pick a food that you want to start with, just do one individual fruit or veggie or a cereal for a couple days at a time while you're getting going, because you just want to watch for adverse reactions. They don't happen very often by any means, but if you do too many things all at one time, it's harder to tease out what the child may have had a reaction to. And really the reactions that we're looking for is swelling on the face. Usually it's going to be mouth and lips, things that have come in contact with the food. They may seem like they're having trouble breathing, very severe diarrhea, or hives, kind of rash, either just on the face or sometimes they get a whole body reaction. Things just like a little redness or irritation on their chin, or a little bit of looser stools, depending upon what they have eaten, is not necessarily an adverse reaction. Those are pretty common. And sometimes food allergies do run in families, so it's not a reason to not try that food with the child, but it's just a reason to maybe really make sure that they have no additional food that same day, just so you can watch them close. And sometimes it does take a few exposures for an allergy to really show up, so just kind of keeping it in the back of your mind. The biggest allergenic foods that we see in our kids are egg whites, peanuts most definitely, tree nuts, fish, shellfish, wheat, sometimes cow's milk, soy, fruits, berries. A lot of those allergies we'll know right away, especially cow's milk if we do any formula, or if you, as a new mom, drink cow's milk in your own diet, that passes through the breast milk. Some of those other ones we often recommend waiting until they're after a year of age to do or to introduce some of those things, just to allow the child to be a little bit bigger, and just to watch very closely for any of those reactions. Your baby needs either breast milk or formula until a year of age as kind of their main source of nutrition, although really with the foods too, we usually start out with about food once a day, which isn't designed to give them many calories at all, but it's just to kind of start the process of eating and learning how to eat. Oftentimes they'll go up to 2 times a day, 3 times a day by about 9 to 12 months or so, so that once kind of we hit that 12-month mark, we can change them over to cow's milk or your milk of choice, and they at that point tolerate that transition well. And once we get them over to a non-formula or breast milk, really they only need about 16 ounces a day. By that point they should be eating most of their calories, and so kind of starting that at the 4 to 6 months just gives a good time frame to kind of go nice and slow, introducing new foods, and getting them used to the textures and the tastes, so that when they get to this age they'll be ready to get over to less milk and more food. And really the reason why we don't introduce cow's milk before a year is mainly cow's milk does not have any iron in it, where the formula does, and the babies are born with iron supplies from mom, and most of those iron supplies are really built up the last couple weeks of the pregnancy, and they kind of go through those iron stores fairly quickly, and they kind of drop their levels, and then once they start eating more food and getting more formula or breast milk, they build those iron levels back up. And so if we introduce cow's milk too early, we lose some of that building up of iron that takes place between 6 and 12 months. And it's harder to digest, so oftentimes we see more tummy troubles and intestine troubles if we introduce cow's milk too early. And then what I usually tell my parents too is when you're kind of going over to cow's milk, one, I would introduce a sippy cup early anyway, just to practice, and even a regular cup, but then getting rid of the bottle, once you're done with formula or breast milk, getting them onto a regular cup or a sippy cup is a great thing to do, and then you can kind of get rid of that bottle. Usually we recommend by about a year. Toddler nutrition, really after a year of age, they should be doing 3 pretty standard meals a day, offering 2 snacks, keeping in mind though that their appetites vary day to day. So one day they may eat a great breakfast and just pick at lunch and dinner. The next day they may eat 3 great meals. The next day they may want nothing to do with food all day. And keeping in mind for toddlers, that is totally okay. Look at the average of what they're getting to eat over the course of a few days, and they will get all the nutrition and things that they need from that. Just remember offering a wide variety of healthy foods, and not necessarily just giving them Cheerios or the typical kind of finger snack foods all day. Offer the fruits, the veggies, they need their meats too, their whole grains. And definitely have to beware of liquids in toddlers. Toddlers love to drink. And if we let them drink too much during the day, they won't eat good because their tummies fill up on liquid. So really, I usually say up to 16 ounces of milk a day. Juice, only if you have to. Water is great. But if you do give juice, make sure it's 100% juice and no more than 6 ounces a day. And I like water, giving them water with snacks and at other times during the day that they're thirsty is perfect. And then I didn't kind of put this in a slide, but you have to too just kind of be very careful with sippy cups and toddlers running around with kind of a drink cup in their hand. Toddlers are somewhat unsteady with their gait. They fall a lot. They have a sippy cup or a cup with a straw or something in their mouth all the time. They can be prone to cutting their lips or their gums, so you just have to be really careful. There's nothing wrong with limiting it to in the kitchen only is where you get your drink, and kind of setting up those good habits early will make it easier when they're 3, 4, 5 years of age. Kids usually start teething anywhere between 6 to 12 months of age. And by age 3, all of their primary or their baby teeth should be in. And you can kind of see in the picture, usually the first teeth that come in are the central incisors. Usually the bottom, but it could be even the top ones. And then they kind of work their way out from there, with the very back molars kind of being the last to erupt. And then also it kind of says when they typically shed them, in case you're planning out that far. Usually symptoms of teething, they drool constantly, although keeping in mind babies that age put lots of things in their mouth and they drool anyway because they're getting used to food and eating, and they're still very, they learn by putting things in their mouth. So, but sometimes maybe more drooling than normal can be a sign of teething. Just putting everything in their mouth. Their gums you might notice get swollen. They may be fussy. Treatment for this: pain relief if they seem to be very uncomfortable, so some ibuprofen or acetaminophen. They like cool things to either kind of chew on, so you can do the teether rings. Just be really careful with certain ones in the freezer because they can get too cold and cause frostbite if your child chews on them. So putting maybe some teether rings in the refrigerator, or even just taking a really cool wet washcloth to chew on. You have to be very, very careful with the teething gels. So the baby oral gel, all that. One, it doesn't always work very great because when your child is drooling so much, trying to get the baby oral gel on their gums, the medicine doesn't like to stay on there. So you're lucky really if you even get a half-hour relief. Plus, there is the topical anesthetic in there, the benzocaine, can be absorbed into the body. And so if you use too much of this medicine and too much gets absorbed, it can cause a very rare blood disorder that inhibits the red blood cells in your body from carrying oxygen effectively, and essentially can really reduce the amount of oxygen that the baby's getting in their body. So I kind of tell a lot of my families just to avoid them, to do some of these other things. But should you be inclined to use it, you have to be very, very, very careful. And teething typically does not cause colds, and it does not cause high fevers. You always want to start to kind of taking care of the baby's mouth and any teeth they may have from early on. So that means before the teeth have even arrived, taking like a soft washcloth or one of those finger mitts, and just wiping their gums off after their feedings. The other thing you can do too, is once you do have that first tooth erupt, whether it's 6 months or 12 months, brushing their teeth then, either with a little very soft baby toothbrush or even the finger mitt again. Just kind of brushing off that tooth or teeth with water for sure, you know, in the morning and definitely after their nighttime feeding. Usually by the time that they're getting teeth in, most babies do not need to eat in the middle of the night. Some want to because they're kind of used to that, but they don't have to. They can go the whole night without eating. So it's definitely important to kind of get that tooth or teeth brushed after their nighttime feeding just to get some sugar off of there. And like I said, really just using water only. You don't want to use any fluoride toothpaste until your child can spit, which is really maybe age 3 or 4. And you have to be careful even using the training toothpaste. The training toothpaste can be helpful to get kind of motivation for a child to brush, but oftentimes they like to just suck on it because it tastes good, and then you still have trouble brushing their teeth because they don't let you in your mouth or in their mouth. So really the biggest thing is just go with the water until the baby's old enough or the child's gets old enough that they can spit out fluoride toothpaste. And once your child gets enough teeth too that you have some teeth next to each other, then you really want to floss. And if you start early and just make it a routine and a habit, your child may not like it because they're trying to be independent and they want to do things themselves, but just by doing it on a daily basis, a little fight is worth the end result. And by the time they're a couple years old, most of them then are pretty darn good teeth brushers. You also want to be really careful and not let your child walk around with milk or juice all day. There's lots of sugar in there, and typically when they walk around with a bottle or a sippy cup in their mouth, they're just letting some of that sugary drink kind of pool in their mouth, which means more time that the liquid has in contact with the teeth. Plus, if you let it walk, let them walk around with it all day, they're not drinking other things like water. It's okay to give your child the milk or the juice, but then follow it either by water or nothing to drink, so that at least the saliva or the water will kind of help get some of that excess sugar off their teeth. We have to be really careful too that if the baby has pacifier dropped on the floor, that we don't put it in our mouth to lick it or moisten it or clean it off, because our mouths have lots of bacteria in it, and our child's mouths don't get a lot of those bacteria until they're older. So by us putting their pacifier in our mouth and then giving it to our baby, it transfers a lot of the bacteria in our mouth to the baby's mouth, and can promote even cavities that way. Again, no bottle propping, because that just promotes the sugary drinks to be in contact with those teeth. When your baby is drinking water, it's okay to do the water with fluoride. It does not have to be the baby water with no fluoride. It does not have to be bottled water only, because the fluoride is going to help promote healthy and strong tooth growth. So we really do want some fluoride in there. And so if you do live in a community that has well water, or for a fact no fluoride in the water, then oftentimes those babies and toddlers will need to be on fluoride supplements to make sure that they get enough fluoride. And then the newer recommendations really are that your child should visit the dentist about 1 year of age, or within about 6 months after the first tooth erupts. You have to be careful. There's a lot of family dentists out there who will say, oh no, they don't need to come see me until the kid's 4 or 5. Well, that's really because they don't want to have to deal with a screaming, uncooperative child. But it's best to get on those kids and to take care of those teeth from early on, because I see kids in my clinic on a weekly basis who have lots of cavities, and they might only be 2 years old, maybe 3 years old, and they have so many cavities that they have to have their teeth repaired under general anesthesia because it's so bad and they can't do it in the office. So one of the biggest things you can do is just get established with a pediatric dentist if you can, or a really good family dentist. But make sure your child is kind of seen at an early age on, and then every 6 months, just to promote those good habits. Sleep. Babies sleep usually at least 14 to 18 hours per day, and they have no good routine at this age. It's okay to try to promote being more awake during the day and quieter, less interactions at nighttime, and stick with it, but oftentimes they kind of have a routine of their own. By about age 2 to 4 months, so you can definitely kind of work on more routine, and they typically sleep, those babies, about 12 to 14 hours total in a day. Age 4 to 6 months, sleep more 11 to 14 hours. And usually they sleep at least 6 hours at night, uninterrupted. Some babies can sleep much longer than that. 6 months to 12 months, they usually sleep a total of 11 to 14 hours per day, but they usually, by those, that age range, definitely capable of sleeping through the entire night without waking up. And then age 1 to 2, about 10 to 12 hours per day. Always want to be on our back to sleep, especially when they're little. The reason for that is it reduces the risk of SIDS. It reduces the risk of suffocation or anything coming into contact with them that they may not be able to get away from. Once they're old enough that they are in their bed, turning over from their back to their tummy and sleeping that way on their own, then it's okay to let them sleep on their tummy. Before that, though, always on their back to sleep. Be really careful with the soft bedding and blankets just so that nothing comes in contact with them that they could suffocate with. It's okay to use white noise just to kind of have something in the background, especially with the newborns. They're used to hearing noises from the external world. They're used to hearing your body noises and your heartbeat. And so when they come out into this nighttime world where it's completely silent, they have troubles with that. So white noise can be helpful. Really starting a routine, definitely by age 2 to 4 months, can help future sleep issues. You want to teach them to fall asleep on their own, which means putting them in their crib when they're drowsy but not yet asleep and letting them put themselves to sleep. Some babies need to kind of fuss and cry a little bit just to kind of get out their excess energy in order for them to fall asleep. Some babies want something to kind of stare at or listen to while they drift to sleep, and some babies, you'll lay them in your bed and they'll go right to sleep. But try to be kind of consistent with the routine too. So that means ideally trying to have naps about the same time every day and a bedtime about the same time every day. And if you give them a bath and read a book, there's no wrong, it's nothing wrong with doing that with a 2-month-old. Just whatever it is, kind of stick with your routine, because babies, as they get older and they learn to recognize those sorts of things, they will associate, oh, I'm getting my bath, I'm getting my book, it must be time for bed. And if possible, it's good to sleep kind of in their own bed for both naps and at night so that they know when they're in that crib or bassinet when they're younger or whatever it is, that it is time then for sleep. And it's okay to put them in their crib from day one. There's nothing wrong with that at all. Toilet training is kind of a big topic as well. And typically, your child is not going to be ready until they can communicate with you the urge to go and they have a desire to be clean. Girls usually want to be clean a lot earlier than boys do. And so it doesn't necessarily mean that they come to you and say, Mommy, I have to go poop. It might be you notice that your child consistently goes and hides in the corner, and every time they do that, they have a poopy diaper. Or they're coming up to you and with a new diaper, because they've dirtied their current diaper. Those are kind of things that tell you that they're understanding what it means to want to be clean. Most children are ready by age 3. Some are ready by age 2, and usually most of the nerve connections in our body that controls kind of bowel and bladder control are not very well developed until about age 2. So if you think your child at a year and a half is ready to be potty trained, go for it. But I say don't expect it, because oftentimes it's usually at least age 2 before they can kind of put everything together. But most kids, it's actually age 3. And try to avoid peer pressure. When your child is ready, they will go. So the more you pressure them or the more expectations you put on them, they may get upset and revert any progress that they've made. And so if they do that, then you just need to drop it, let it go for a few weeks, and try again. And start early. Let them watch you go to the bathroom when they follow you in there, and talk about going potty and going poop and kind of what the toilet is. Sometimes the younger kids can even be in charge of flushing the toilet after somebody's gone to the bathroom, just to kind of get some of that associations down without the pressure of them having to sit on the toilet and going. There's lots of good books out there that can help with that. when they're starting to show any interest, I like to say have set times where they're sit on the toilet. That's usually first thing in the morning, before bath time, right before bed, kind of set times that you would normally have them go anyway, and don't have any expectations that they will go, but at least kind of get them into the habit or the routine that this is kind of an expected thing that happens around these times. You can put them in training pants and devote time to practice. So usually that's on the weekend, or if you have some vacation, kind of you need time to really practice and to really kind of watch your child for all those cues that they have to go when you're at home. And praise successes. It doesn't necessarily mean having to give them something every time, although sometimes stickers can be helpful or things like that, but they like attention. Toddlers love attention at this age. And so just praising their success, talking it up, saying that's such a good job, even when they just sit on the toilet and maybe don't complain or don't whine or run off right away. And definitely lots of praise when they do go to the bathroom in the toilet. If you are working on potty training and all you hear are no's, or you're having to drag them into the bathroom, or they're having a lot of accidents in their training pants, then your child probably is not quite ready. Let it go. Don't push it. Give it a couple weeks and try again. Illnesses are also very common the first several years of their life. And children are supposed to get sick. They're born with a pretty limited immune system. And the only way that it becomes developed is through exposures to germs. And they get germs everywhere, but typically our babies, we need to protect them to a certain extent because they are so little that we tend to kind of keep them sheltered in the home. But usually most kids under the age of 5 get an average of at least 8 viral infections every year. And most of them are typically October to April through kind of the late fall, winter, early spring seasons. Most of them last 7 to 14 days. So really, it might seem like your child is sick more than they are well, which sometimes is the case the first couple years of life, just because a lot of those infections last so long, and they kind of seem to get them back to back. Usually they're only contagious the first 3 or 4 days, or especially if they have a fever. By the time kind of the 3 or 4 days are over, they're still going to have a runny nose, they're still going to have snot everywhere, but at that point it's not necessarily contagious, and they can be at daycare and they can be out and about. Usually the second child gets more infections than the first child. The first child is usually a little more sheltered, it's the first baby, they're kept at home more. Well, by the time the second child comes around, they are out and about because they have errands to run, and maybe the other child is in daycare or in school and bringing more things home. A fever, for definition of a fever, is really above 100.4 degrees. And we as pediatricians get a little more anxious if we have a parent of a child less than 2 months call us and say our child has a fever that's 100.4 degrees or greater than that. Just because in the babies it can be more serious and they don't have as many symptoms to go off of as the bigger kids do. So definitely you want to notify your doctor in a little baby who has any fever, or if they are a bigger kid whose fever lasts more than 3 days, just to make sure that there's nothing else going on. Lots of things cause illnesses. The biggest, is really kind of the bacteria and viruses, and typically we can kind of get an idea over the phone or being seen in the clinic which is which. Usually with bacterial infections, your child looks a lot sicker than they do with viral infections. So if I have a kid who comes into the office and he has a fever and maybe a runny nose, but he's smiling and playing, he looks much better than the child who comes in who's just laying there and who lets you poke and prod and look at their ears and all this and doesn't move. That worries me more than the kid who's smiling at you and still kind of wanting to play sometimes. They might be fussy and they might be more tired, but they're still smiling is a good sign. Typically higher fevers or fevers that last more than 4 days can be more indicative of a bacterial infection than a viral infection. Bacteria also like to localize more in certain areas, so it could be pneumonias or sinus or ears abscess on the body. And usually bacteria will have more abnormal lab work than a viral infection will. So sometimes we can kind of get some clues if we do lab work. Green snot does not necessarily equal a bacterial infection. It just means your body is fighting something. And it depends kind of what cells really are coming out to fight them. So color does not tell us that it's a bacterial sinus infection. And most illnesses do not require antibiotics. Safety. Car seats. The old recommendations used to be that your child needed to face the back seat till they were 1 year of age. It was kind of that magic number in 20 pounds. Well, studies show that really your child is safest when they are facing the back seat of the car till at least about 2 years of age. And so that means a lot of times you're having to get bigger car seats that can accommodate bigger kids facing the back. So really, you may need to go from kind of an infant carrier seat, the one that you can take out of the base and carry with you everywhere, to a convertible seat that stays in the car at all times. But the convertible seats can face backwards or can face forwards, and they have a lot higher weight limits, height limits. So ideally, till as close to 2 as possible, facing the back is the best place for your child and the safest. Once they're about age 2, then you can face them forward so they can enjoy seeing the world, but they still need a car seat with kind of the 5-point harnesses until they really max out the weight and the height limits for those seats. And typically that could be age 4 or sometimes even higher than that. Before then they're ready to go kind of to the booster seat with just the normal car seat strap. Have to be very careful with our younger kids and our toddlers, especially around water. Never, ever, ever leave them unattended. Even the smallest amount of water. They could even be toilets. If they fall in, if their head gets stuck, they still don't have enough muscle control to be able to pull them out of a lot of those situations. And then you have to be really careful too that they don't burn themselves. So keeping the water heater set to no more than 120 degrees can help with that. You want to make sure you baby-proof the house. Keep harmful things locked up, out of sight. That includes all chemicals, medicines, guns, sharp objects, pretty much anything that's out in plain sight. Your child is going to want to play with. They're exploring. They're going to want to. And no matter how many times you tell them no, they're still going to try to see what they can get away with. So you just have to be really careful. Gates up so they can't fall down the stairs. Plug covers so they can't stick their fingers or anything in the plugs. What can you do to help your child's development? Lots of things starting from day 1. Cuddle them, talk to them, singing, telling stories, rubbing lotion and massaging, them after bath time, just touching them, reading to them from an early age, doing lots of tummy time, whether they like it or not. They can be just short 5-minute intervals at a time, several times throughout the day. Playing with lots of toys, and it doesn't have to be expensive toys. It can be things around the house, just anything with different textures and colors. They like noises and bright lights. Playing games, peekaboo, pat a cake. All those things will help your child develop. So really, with your kids, have fun. The time goes by so fast. Enjoy the big moments, the small moments. Just, in the middle of the night, when they're awake and crying, just think it won't be this way forever and just kind of enjoy the time. I always like to think when my daughter's up in the middle of the night that she just wanted to see me. And so it kind of makes life easier that way. And despite what a lot of dads say, my husband is the same way, it's okay to take lots of pictures and don't be ashamed of that. So some references that I used, healthychildren.org is a really good website. It's the American Academy of Pediatrics Parents website. It has some really good information. Our website here for the hospital, children'somaha.org, also has a kind of parent resource guide, which can be helpful as well. And then the books Baby 411 and Toddler 411 can be helpful. Okay, any questions? Yes?
What about honey?
Honey, very good question. Honey, you should not give before 1 year of age because the spores that are in honey can cause botulism in babies. which is just kind of a paralysis disorder, and it can paralyze their breathing muscles. So after a year of age, it's fine to give them honey. And sometimes too, really with the illnesses, there's not a whole lot to do with the illnesses when kids get sick besides saline in their nose to help clear the snot. But honey can be a good natural cough soother, so that's something to think about in a sick kid, and then kind of Vicks rub and humidifier and all that good stuff. But very good question. Yeah.
So only brush your teeth with water for like the first year?
Yep. It's just to kind of get some sugar off their teeth, and the water alone will do it. And two, it gets your kids in the habit that there's going to be things kind of wiping at their teeth. But yeah, because otherwise, if you try to do the kitty toothpaste too early without the fluoride, they just suck on it and you don't end up getting anywhere. So yep, water is just fine. Yep. Yes.
Peanut butter. I'm sorry. Peanut butter, speaking about food, at what age can we do like nuts or almond milk or stuff like that derives from peanuts?
Usually after a year.
Just 1 year?
So, yeah, is what I say. And the really thing is kind of the peanut butter definitely is fine. Just kind of, I say, start small, small amount. Don't throw like a big, huge sandwich all, at once. But you have to be really careful though. The actual nuts, those you don't want to do probably until they're at least several years old because of the risk for choking. Because then if they get those nuts or even the nut shells into their lungs rather into their stomach, that can cause some pretty bad pneumonias and other things, and those are really hard to go fish out from the lungs. So definitely anything that's choking, after a year, most of our kids are on table foods by that point, which is okay to do. And as long as it's safe in terms of size, that they can't choke on anything, everything's cut up super small, and you don't want to put a huge amount of food on the tray so that they're not just like shoving everything into their mouth and trying to swallow. So yeah, usually I say about a year. And it's fine after a year to do almond milk or whatnot if you wanted to go that route. Yep. Yes.
What about breastfeeding moms on vitamin D supplements? Will that get passed on to the child?
It does to a certain extent, but I still usually have babies on. And normally the vitamin D amount for the babies is like a full, just 1 ml or 1 dropper full. In that case, we could even just do like a half, just so they're getting a little extra, because it depends. Some moms are kind of deficient in the vitamin D. So what I'm afraid of is the vitamin D that moms will be on will supplement their stores, but may not have enough left over to cross over to the baby. Yep. Yes.
Our daughter's been getting a lot of like eye boogers, and I don't want to like touch her eyes, but I know when I get it, it's really uncomfortable in my eyes. So I was just wondering, is it an issue? Should I try and get it out?
How old's your daughter?
She will be 4 months in a week.
In the first 1 year of life, it's very common to get the mattering and kind of the goopy eyes. The reason is the tear ducts are kind of on the corners of the eyes, and they drain into their nose. And a lot of newborns have kind of some congestion, and their nose gets congested easier because they mainly know how to breathe through their nose, not through their mouth. So that doesn't bother me if they kind of have the eye goobers the first year of life. The best thing is to do is just to take like a wet wipe or a clean soft washcloth and just kind of gently wipe away any of the mattering. And sometimes if your child is more prone to it, doing a little bit of tear duct massage kind of on a daily basis or with every diaper change can help. Whereas if you take the wet washcloth and just kind of rub on the corner of the eye and kind of work your way down a little bit just to kind of help promote that duct to open up and drain down into the nose. Sometimes we can do drops too. So if you have pictures or an event coming up and here your child has this crazy goopy eye, don't panic. Just let your doctor know, and we can do some eye drops to kind of at least calm it down for a little bit, but it's nothing to be worried about. The only time we usually refer to like an eye doctor for it is if they're still having lots of trouble at a year of age, but thankfully that does not happen very often at all. So, yep, good question. Yes.
My kid, she's a year old, and she's like all over the place. So one day I come home from work and her chipped, like she chipped a tooth, and I'm like crying because, you know, it's my first baby. Then I get over it. I'm all right. But then like 2 days ago, she chipped the other side of the chipped tooth. So now she has like this funky tooth going on. Like, is she not getting like calcium? Like, why is her teeth? I don't get it. Like, why are they chipping?
I think it's more trauma than anything, and their teeth are fairly fragile to a certain extent for the baby teeth. And so it seems like they just hit it at the right angle, or depending on the surface that they hit, and they can crack. You know, that would be a good thing just to, you know, off to the dentist just to make sure everything's doing okay. And a lot of times they'll just say, and yeah, don't take it personal. It happens all the time. We get phone calls on it all the time. They may even knock a tooth out just because everything kind of attached to the gums and whatnot is not designed to be there forever. So they're more sensitive, but that doesn't mean that she's not getting enough calcium. It's just kind of a part of being a toddler. And it looks silly, but just take pictures and it'll be a good story to tell her when she gets older. But yeah, it's harder on us than it is on them usually. Anything else? All right, well, thanks so much for coming. If you need anything else, I'll be here for a couple minutes. Okay, thank you.